Thanks, Eric and Ted. I'm going to talk about how we prepare our residents for FES at the Medical College of Wisconsin. And to do that, I have to talk about it in the context of FEC because that's how we prepare them. So I'll just do FEC up until they take the FES exam in our program, at least. So before we get into it, I'll just describe the structure of our education system, resident education system at MCW, because this does make a difference in how you implement your curriculum. We have a protected block curriculum where the PGY 1 and 2 residents are out of clinical service for 4 days every 2 months, and we work on skills and didactic materials during those blocked protected curriculum days. And that's where I've implemented most of our initial endoscopy training. We have a 1-month endoscopy rotation with the gastroenterologists in our GI lab, and they do that as a PGY 2. We do have an endoscopy simulator, computer-based, and then I try and get them to take FES before or by PGY 3 year. So the emphasis on completing most of the FEC curriculum is during the PGY 1, 2, and 3 years at our program. We do have some things that go beyond that, but I try and use FEC to prepare them for the GI lab so that they can get in there and really know how to use the equipment and be able to, I guess, be actively involved in the scoping a bit more quickly when they're in that 1-month GI rotation. So at our block curriculums, what I end up doing is prior to each curriculum, they have a cognitive didactic assignment. And the resources that I use for this are the SCORE modules that are linked to our FEC document. In the PGY 2 year, I use the clinical items in Appendix B of the document. I use the SCORE videos. I use articles that I've selected out of the ASGE guidelines up to date and some journal articles. I use simulator videos. We have the GI Mentor 2, and I have to see a lot more of Eric Pauly than I want watching all those videos because he produced all of those, but he does a really nice job, and Eric, you've trained all of our residents, so thank you. And then I use the FES didactic modules as well. And then they have simulator assignments that they need to do, and I'll show you some examples of how we do this. During our block curriculum, with the absence of real hard proficiency targets for some of these simulator skills, the route I've gone is mentored feedback. So we have a faculty member in there doing the skill, or basically watching them do skills and giving them feedback at every single block curriculum. Then they practice between those curriculums and then revisit it with a faculty member at the next curriculum. So this is sort of that expert feedback that they're getting to try and get them up to speed. We also have additional sessions on the introduction to the endoscope and the endoscopy tower troubleshooting, and then working in the GI lab. So I picked April because that's the one that we have coming up. And this is just an example of how that block curriculum works. Their pre-assignment, reading assignment for this particular one is 2 up-to-date modules on colorectal cancer screening and the different screening tools that are available, and then an ASGE guideline on quality indicators in colonoscopy. I have them watch several of the videos on mucosal evaluation, and then they have mucosal evaluation skills tasks that I ask them to do before the curriculum. During the curriculum, then I meet with each of the residents, and we go over each of these skills, and I watch them do them. And then I do some of the colonoscopy modules on the simulator and grade them with gauges on it. And we do the same colonoscopy modules each time so that I can track their gauges score on the simulator, so they get used to that kind of feedback for when they hit the GI lab. Just an example of our curriculum to follow that. This one is more related to the endoscopy tower and equipment. I have one article that I found that is a great description of how the endoscope works and the different components to it. Some guidelines on reprocessing, and then a video on utilizing the equipment. We have some skills assignments, and then during the curriculum, I go over the skills, and then we take them down to the GI lab, and I have a test for them where they have to take apart the endoscopy tower, put it back together, troubleshoot different problems that I've built into the system. So then they do their endoscopy rotation as a PGY2. They're usually pretty well prepared for this coming in. On that rotation, I ask them to obviously get their numbers and then complete gauges evaluations. And I have the faculty down in the GI lab do an evaluation of them, and I ask their resident to fill out their own personal evaluation as well, so that we can compare and make sure that they have good insight into how well they're performing. Then I have them take the FES test at the end of the PGY2 or start of the PGY3 year. Right before the test, one of the faculty meets with them for an endoscopy boot camp. Really, this is just reviewing what the test is, reviewing what didactic materials are available to them, reviewing what skills are on the exam, and then we do some skills sessions on the simulator with mentored feedback. And then for self-directed learning, I asked them to go to Appendix B, again in the FEC document, and review any topics that they feel haven't been well covered in their clinical rotations up to that point. The cognitive resources that I asked them to utilize, the FES website. Obviously, this is the primary preparation source for the didactic material. The FEC document by the ABS has links to SCORE. I use the ASGE practice guidelines, and then the SAGES video atlas of endoscopy developed by our flexible endoscopy committee. Since there are some images and videos on the actual FES exam, this is a good way to expose them to extra pathology that they may not have seen during their rotations. And then, as some others alluded to as well, I asked them to go to the SAGES webinar video, and specifically the whole video is good, but if they're just going to really utilize their time the best, I ask them to go to Jeff Mark's section, which everyone wants to know what's on the exam, and he actually shows himself taking a portion of the exam and what you're going to encounter on it. And so I think that's a really good resource for them as well. Finally, I ask them to do certain modules on the skills exam, and I'm excited, Eric, for your presentation to find out some of the proficiency measures you found for these. And like everyone else, we're still waiting for the module on loop reduction, but there's modules for each of these, with the exception of loop reduction, that I asked them to go through and have a faculty proctor work on each of these modules with them before they take the test. Thank you.